outcomes of one surgeon are different from the other surgeon. So subjectivity in that fashion is what comes in the hamper. So a process may be Lean Sigma. Your billing correction, the correct billing may go as 6 sigma. Your correct prescription may go as 6 sigma. Your correct pharmacy distribution may go as 6 sigma. But many other processes cannot be certified. So hospital may not be there, but there are a lot of advantages which you can have with 6 sigma. Accreditation, of course, is something which you are being faced with every day. And, there are the elements, 4 elements of any accreditation system in the world. Otherwise, SQI is not going to accept it. It has to be voluntary. The standards are laid down and fixed and revised on the periodical basis. Compliance is measured by external review. And the outcome of standards only denotes compliance. Now, these are the 4 elements of any accreditation system, whether it's Indian accreditation or Thai accreditation or Jordanian accreditation or Joint Commission US. They work on these 4 principles. Ultimately, it should ensure safer care. That's what it is. Laboratory accreditation, NABL is the process. It comes in the Ministry of Science and Technology, and it provides laboratory accreditation under ISO 17025 and 15189. Now, remember, whether we are getting ISO, NABL from India, or it is from JCI, or it is from College of American Pathologists, they all follow the same standard. So standard being followed is the same. So it's kind of replicable from one place to another place without much of difficulty. I'm right now not going to the main benefits and all that because time is short and I'll like to wrap up in the next 10 minutes time. But at the same time, you are exposed to many times the College of American Pathologists accreditation, CAP. We have laboratories in India which are CAP accredited. It also follows, if you look at it, the same ISO standard. But again, many of the laboratories which want to participate in the international programs, which are got international clients, which have got clients which are requiring FDA compliant laboratories, this becomes important and the hospital are required to be going for it. Benefits wise, it probably offers the same benefits which you get from NABL accredited laboratories. So I would say, at least let's aim for having NABL accredited laboratories and as many as possible. And because today, unfortunately, the number of NABL accredited labs remains less than 1,000 in a country which may be having lakhs of laboratories. So there is an absolute lack of standardization there. We need to look at that. Hospital accreditation, NABH, because that's what I'll talk first. 10 chapters, 102 standards, 636 objective elements, all standards are core standards. Last point is important, all standard core standards, because some of the accreditation standards in the world, they say desirable standards and required standards. In Indian accreditation system, there is nothing like desirable. All standards are core standard. They all have to be followed. NABH now also is an SQI accredited organization. SQI is the international standards for organization for accreditation of the accreditation agencies. So whether it's Joint Commission US or JCI or NABH or anyone, they all require SQI accreditation. And India is now playing a very important role in that. In fact, the accreditation committee of SQI is now headed by an Indian. So that's the kind of importance which SQI has got it. So if an Indian standard, and also NABH has now started its own wing, that's NABH International, has actually accredited a couple of centers in Philippines by now. So we are also growing to that global. The standards are, there are 10 chapters: access, assessment, continuity of care, care of patient, management of medication, patient right education, hospital infection control, CQI, responsibilities of management, facility management, safety, human resource management, information management systems. There are other being launched by NABH, that's small healthcare organization already launched, blood banks already launched, ambulatory care launched, primary healthcare already launched, urban healthcare center already launched. Dental already launched, imaging already launched. Medical laboratory program as a certified program has been separately launched, ORT centers and wellness centers. So these are the kind of accreditation which are offered by them. I'll also touch for 1 minute on JCI, because from international accreditation, there are many centers which like to go for it. And the process remains the similar ones. From 1st April 2014, a new standard of JCI has been brought in, so that's the most current. It's got 4 sections, and I would special draw attention, first time in the world, any accreditation organization has said they're required to be accreditation participation requirements. So before you participate in the JCI accreditation program, there are requirements listed for the organization to meet. And other chapters remain patient-centered, healthcare organization-centered, and also important is section 4, that academic medical standards are required to meet 2 more standards, 2 more chapters than what is required in otherwise the standards, the part section 1 and section 2, they practically talk of same language as there would be maybe in the NABH for that matter, a similar kind of chapters. Only in the last 2, you find medical professional education and human subject research program, they too have been added as the separate chapters for that purpose. International patient safety goals find a separate chapterization in JCI. Identify patient correctly, improve effective communication, improve safety of high alert medication, ensure correct site, correct procedure, correct patient surgery, reduce the risk of healthcare acquired infection, reduce the risk of patient harm resulting from falls. You'll ask me, is it not there in the NABH? It is there, but spread over various chapters. Here it has been focused as the one chapter. There are other accreditations like Australian, Canadian, they all are available. New standards are coming up for people to follow. Clinical Establishment Act, standard requirement by TPAs and other third-party payers, medical tourism standards, and revised regulatory requirements as patient safety, fire safety, environment safety, building safety, especially coming for the hospitals or healthcare organizations. Clinical Establishment Act, I believe someone has already talked about it yesterday, so I would like to skip that, only with one point, that the Ministry of Health and Family Welfare has already brought out draft standards. They are there in the Ministry of Health and Family Welfare website for the public and the professionals to comment upon. Unfortunately, 15 days have passed, not a single comment has been received by the ministry. What's going to happen after 1 month, they will become the published standard, and then people will say that they are very bad standards or very good standard, whatever it is. But fact is, the Clinical Establishment Act standards are now on the website, and it will become applicable very soon. 7 states have already adopted it. Come what may, you follow NABH standard, JCI standard, anything, process remains same. Or you don't follow any standard, follow your internal standards. Process remains same. Plan, set standard, communicate standard, monitor, identify and prioritize the opportunities for improvement, define the problem, identify who will work on the problem, analyze and study the problem, choose and design solutions, implement solutions. Again, you may go wrong. I'm finishing. I'm just taking 1 minute to finish off. That's the problem with me. When I start talking about quality, the passion drives me and I lose my orientation. But I'll just take a couple of minutes more before I close. And sorry to the organizers for having taken two little extra. The issues which are facing. In India, we say we don't need it. We have got so much of numbers. Why should we go for accreditation? We are very happy with that. I have got 200 patients lined out every day. Do I need to implement any more quality? That's itself a sign of quality. The effectiveness in performance is always an issue, and multiple accreditation systems sometimes confuse us. I'll just skip some of the slides. Quality and cost, that has always been an issue. I believe otherwise. I always believe that quality reduces the cost. If it is increasing the cost, please look back. You are gone wrong somewhere. Revise your systems, and they'll help you. This is a very generic, the last point I say, it's a continuous assessment. It's a continuous system. It's not something which you say, I have achieved it today. You're always an underachiever, or what my mentor used to say, there is always room for one thing in life, that is for improvement. So achieve that by improving every day. There are a number of challenges, lack of commitment, lack of time, lack of communication. I tried to address a gathering of many people. The first time I was trying to do it in Gujarat, 400 people attended my lecture. I was very, very happy. I came back feeling very big about it. During tea break, I asked some of them, how was it? Saab kuch samajh nahi aaya. Because they understood only Gujarati. And I was being very good, trying to talk to them in Hindi or part English. I had to translate the NABH standards into Gujarati to make them understand. So communicate to the people in the language they understand, and don't have any biases. At the end, my favorite slide, which I always bring in. If you have your family member admitted in the hospital, what level of safety you desire? It's like a KBC question, multiple options. What's the answer? Obviously, none of the above. We don't expect 0.1% because 0.1% can mean many of these things. Heart fails to beat 32,000 times. You can skip a heartbeat for your girlfriend or boyfriend, that's okay. But skipping you 32,000 times is going to become very disastrous. And many other things. These are based upon studies done internationally. And last, who has been the biggest quality proponent or quality guru in the universe so far? Who has been? Do you know that person? Do you know who has been the biggest quality guru? The God himself. Because he made a chimpanzee first, and after that, what did he do? He did a gap analysis. And in the gap analysis, in the DNA sequencing, there has been a bit of difficulty, 1% difference. He redid that, did the correction, the corrective actions and preventive actions as we call it. And what came up was a human being. Suppose God was not a quality professional, what would have happened? Who would have been talking to you today? Of course, with one consolation, the audience would have been the same. So thank God that he was a quality professional. And with that, I end today's talk. I will not be, the only thing I want to say, this journey has just begun. This is not the end. We are at a very, very nascent stage. Let's move forward to make it happen. I said I'm not using any unstandard statement. This is the only standard statement which I've made from my side. So one statement has come from me also in the whole presentation. The last, did I say anything today which you didn't know? Did I really talk anything which you didn't know? You knew everything. But please apply it. Let's work together to do that. And for that, you don't need anything. You basically need one thing, a positive attitude. Let's get away from the negativity of it, why it cannot be done. Let's do it positively. Thank you so much. To do. In fact, creating a strong leadership in the organization is very, very important. I think these are the doctors who are first required to be tackled. And when you actually sit with them with some patience, explain them what you are trying to do. Because ultimately, if you are going to give patient safety, his patients are going to be saved. If you are going to give better outcomes, his patient is going to have the better outcomes. And I have implemented this program in more than 200 organizations so far. And we haven't failed ever.
So
it needs...
We are juniors, they are unable to speak in front of them.
I don't think the junior and the senior has got a role. In fact, the charming lady like you can become much more important than a person to... he may not like to listen to a grey-haired man like me. But at the same time, you have to be convincing, you have to be knowledgeable, you have the facts and figures on your hand to convince a senior person. Let's give a due respect. If he's a senior and respected person, we just cannot start with this, that he is fooling patients. You tell a person that you are fooling patients, he'll throw you out of the room. You have to go give due respect to their seniority, their knowledge. If they have become big, they have become big because they have something good in them. Respect that goodness and trying to bring that into process. In Hinduja Hospital, Bombay, we started our program and we wanted them to create clinical protocols. Some of them said, we are following it for the last 20 years. What are you going to do? And all I told him, I said, what you are doing, I'm just writing that in a process. And then he opened up. He said, the process I already have. I said, this is exactly what I'm demanding from you. So they all are doing something good. Respect their goodness, be persistent, be consistent, be knowledgeable. You will be rewarded, I can assure you that. Your own quality is going to determine their quality.
Thank you, sir. Can I ask a question, please? Excuse me?
Yeah.
Just one last question, please.
Hello, sir.
Yeah. Which side is coming from? Yeah.
Sir, I would like to know how many government hospitals are NABH accredited?
Okay. I don't have the numbers exact right now, but personally, I have been involved with the accreditation program, whole of Gujarat government. And in Gujarat, we have been able to have 5 government hospitals which are already accredited. The second place